The IDA drug therapy. The oral iron is a good option because it is expensive and convenient. Many iron preparations are available. So when giving the ions, consider the following considerations. Uh, enteric coated or sustained release capsules are counterproductive and also very expensive, not necessary. The daily dose is 150 to 200 milligram, which can be taken 50 milligram TID or QID. The iron should be taken about 1 hour before the meal, when the duodenal mucosa is most acidic. Taking iron with vitamin C and orange juice can enhance the iron absorption. Dilute and use a straw since the undiluted liquid iron may stain teeth. The GI side effect including heartburn, constipation, or diarrhea. So have the patient stay upright for 30 minutes after taking the oral form. Gastric side effect may necessitate taking iron with meal. It's okay. Educate patient iron preparation can cause stool to become black. Constipation is common, so start on the stool softener and the laxative is as needed if needed. Cannot tolerate ferrous sulfate, you try the ferrous glutamate. In some situations, it may be necessary to give the iron parenterally. The parenteral use of the iron is indicated for the more absorption, intolerance of the oral ions, a need for the iron beyond the oral limits, or poor patient adherence in taking the oral preparation of the iron. No matter, there's nothing to write down here, but from my point of view in the clinical, we will see the IV form of the ions will has less constipation, less diarrhea, since they go into the blood directly. The parenterally ion injection can be given the IM injection or IV push. Some IV ion preparation has a risk for the allergic reaction, so monitor the patient. The sodium ferrous glutamate and the iron sucrose are alternatives and may carry less risk for life-threatening anaphylaxis. Because the IM injection can stain the skin, so use the Z-Pack injection technique, which is the only one during the nursing school, so pay attention to that. Reassess the hemoglobin and the RBC count to evaluate the response to the therapy. Stress adherence with the dietary and the drug therapy to replenish the body's iron store. So the patient need to educate on taking iron therapy for 2 or 3 months after the hemoglobin level return to the normal. Monitor the patient who need a lifelong iron supplement for the potential liver problem related to the iron storage.
Patient education on taking iron supplements, timing and food considerations. After meals, iron can cause gastrointestinal discomfort if taken on an empty stomach. Advise patients to take it after meals to minimize stomach upset, although the best absorption is when taking iron on an empty stomach. Avoid dairy, tea, and coffee. Calcium and tannins can inhibit iron absorption. Recommend spacing iron supplements away from milk, tea, or coffee by at least 1 to 2 hours. Using a straw and dilution. To protect teeth, if taking liquid iron, encourage the patient to dilute the dose in water or juice and drink it through a straw to prevent teeth staining. Dilution. Diluting the iron supplement can help with palatability and reduce the chance of gastrointestinal irritation. Preventing constipation. Increased fluids and fiber. Constipation is a common side effect of iron supplements. Encourage the patient to drink plenty of water and include fiber-rich foods like fruits, vegetables, and whole grains in their diet. Physical activity. Regular movement can help ease constipation associated with iron supplements. Promoting absorption. Vitamin C. Encourage taking iron with a source of vitamin C, such as orange juice, as it enhances iron absorption. Avoid antacids and calcium supplements. Separate these from iron doses by at least 2 hours, as they can interfere with iron absorption. Expected effects. Dark stools. Educate the patient that black or dark stools are common with iron therapy and not a cause for concern unless accompanied by other symptoms like pain or bleeding. Consistency and patience. Duration. Remind the patient that iron supplementation can take a few months to show improvement in lab values, so persistence and adherence are key. Follow-up. Encourage regular follow-up appointments to assess hemoglobin levels and monitor for side effects. In summary, taking iron with meals, using a straw, increasing fluids, and being mindful of food interactions will help manage side effects and improve the effectiveness of iron therapy for IDA.